Hello, everyone. I'm Dr. Heather Flynn. I'm a professor at the Florida State University College of Medicine and director of the FSU Center for Behavioral Health Integration. We're very excited to have our team here to talk to you today about the Florida BH Impact program. IMPACT stands for Improving Maternal and Pediatric Access, Care, and Treatment for Behavioral Health. We have a wonderful team, including our psychiatrist consultant, Dr. K. Roussos-Ross, who you'll hear from, and also our resource and referral specialist, Dr. AMANDLA SHABAKA-HAYNES. The vision of our program is that no perinatal woman in target regions in Florida will be untreated for perinatal behavioral health disorders. We have 5 components of the program: systematic screening for all pregnant postpartum women for behavioral health risk using validated tools, training and support for obstetrics clinicians and behavioral health clinicians, access to psychiatric consultation, and then training for community resources, training behavioral clinicians. And one of the big focuses of our program is connecting patients, families, and providers with resources. Our partners include the Florida Department of Health, Florida Healthy Start, the Florida Maternal Mental Health Collaborative, University of Florida, Florida ACOG, and a number of other partners throughout the state. Our overall goal is to help to empower clinicians to detect, treat, and manage behavioral health disorders in the state of Florida. And I'll now turn it over to our wonderful resource coordinator, Dr. AMANDLA SHABAKA-HAYNES.
My name is Dr. AMANDLA SHABAKA-HAYNES. I am a physician by training, but I am also the resource and referral specialist for the Florida BH Impact program. As such, I am the first person that you will interface with when you interact with our program. We provide psychiatric consultation, and we also provide you with resources and referral information for your patients. If you call me, or if you have questions about your patient's mental health needs, I will answer your call, and I will access our statewide directory, which has a listing of mental health providers in the state, as well as support services that are available. And that list can be filtered out based on your patient's location and the insurance that they currently have. If you're calling about a consultation and you want to talk to Dr. Roussos, I will gather some information from you about your patient, and I will gather your contact information so she can call you back at the right number. And, you know, it will be that process from the time that you call in to the time that you talk to Dr. Roussos. We also provide a number of other services. Our website provides toolkits for providers that have different treatment and management algorithms for various mental and behavioral health conditions. And we also, as Dr. Flynn mentioned, we partner with a number of organizations and agencies, and we can tap into the resources that they're directly connected to. So I look forward to interfacing with our provider community. Thank you.
Hello, everyone. I'm Kay Roussos-Ross. I am a practicing OBGYN, also boarded in obstetrics gynecology, psychiatry, and addiction medicine. And so my role for BH Impact is as the psychiatric consultant. So essentially what I do is take calls from any physicians or advanced practice providers related to any diagnoses, from substance diagnoses to depression to anxiety to dual diagnoses. So the process goes, as AMANDLA mentioned, we will have you call in to our phone number, which is 833-951-0296. You will let her know that you're interested in speaking to me directly. She'll get some information from you related to your patient, and then she'll text me. And as soon as I get that text, almost always I'm able to call back within that hour. As I mentioned initially, I am seeing patients myself as well. So if I happen to be in the OR or seeing my own OB patients, it may be a little bit of time that I call you back, but we'll always call you back on the same day, and we're always available Monday through Friday, every day. So when I give you a call back, it's always best if you give me the best number that you have available so that we are able to communicate effectively. I'll ask you some questions about your patient, and then we will come up together with the appropriate diagnosis, what we both think is appropriate. And then we'll talk about different management options. The main purpose of my role, the way I see my role, is really to help you feel confident and competent in taking care of women with substance use and psychiatric disorders in pregnancy. And so through us talking and discussing the patient, the hope and the goal is that you feel comfortable in taking care of that patient on your own. We all know that when a woman becomes pregnant, many times the first thing she does is potentially stop taking her medications. Other times it's that she might be under the care of a psychiatrist or an addiction specialist, and they feel uncomfortable continuing her care because they're scared about the baby and what might happen with the baby. So they stop the medications. Or sometimes they continue the medications and she sees her obstetrics provider, and that obstetrics provider might feel uncomfortable and they stop the medicines. So our purpose here, as Dr. FLYNN mentioned, is really to make sure that all women in our state have clinicians that feel capacitated and comfortable in taking care of their psychiatric and substance use needs. So as we talk about the patient, as I mentioned, we'll come up with a treatment plan, and then hopefully you will feel comfortable in taking care of that patient. I love and I welcome you to call me back again on that same patient if you want to continue sort of working together on the care of that patient. There may be times where you have a really complicated patient and you're just really not sure exactly what to do, and I may ask you questions and you may have great answers and I may still not know what to do. And in those cases, we actually offer a one-time face-to-face consultation with that patient. Now, in the days prior to COVID, that patient would have to drive to Gainesville to see me in person, but now we actually have telehealth option as well. So if the patient's agreeable, I can see them via telehealth for consultation, and then I can make my recommendations to you, and I can call you with those recommendations and send you my letter as well. So again, my role here is to empower you so that you feel comfortable and confident in taking care of these women. I am here to work with you and beside you in offering this care to women. Hopefully you'll give us a call. Again, our number is 833-951-0296. Our hope is that you won't just call and work with us, but that you'll actually enroll in our program. Enrolling in our program will also give you access to me to come to your facility and give a grand rounds or give a lecture during your department meeting on depression, on anxiety, on bipolar, on substance use. Additionally, you get additional services through that. We can help you with your screening methods. We can help teach your clinical staff and your nurses how to appropriately screen patients and help you with that. We also have people that can help with IT services related to screening so that you can show enhanced care in your clinical practices. Really anything you need and anything we can do to help you take care of your patients, that is why we're here with BH Impact, and we hope you'll give us a call.